All right. You are one people. Yeah, shut up boy once again. Wednesday asubuhi doing it for Willis Raburu. Bado anafanya mtihani zake na mimi ananipatia mitihani huku. Tunapambana vile inafaa. Na ikiwa Wednesday tunaongeleaga mambo ya health, si ndio? Alafu leo tunataka kuongelea health ya macho. Eye care. Sawa sawa? Yeah. Of course sio mimi ndo daktari wa macho. Tuanze kuongelea. Niko na daktari, wacha introduce. Mambo.
Mzuri sana.
You good?
Yes, I'm good.
Nisita kuongelesha Sheng. Tuongea kizungu.
Better not so.
Ndio.
Yes.
So how are you?
I'm very fine.
Please kindly introduce yourself.
Yes, thank you Shataboy for welcoming to the studio today. So my name is Dr. Brenda Walaba. Yes, I'm a consultant ophthalmologist, daktari wa macho. Yes.
Unajua mimi kutoka nizaliwe mimi najua daktari wa macho yuto optician. Sawa, hiyo ndio kitu mimi najua. I am going to an optician, but now I am seeing a new name. So what is the difference?
So now, an ophthalmologist first is a medical doctor. So you have to be trained as a medical doctor for you to become an ophthalmologist. So an ophthalmologist is actually a medical doctor who is specialized in giving both medical and surgical eye care. And then now we have opticians. Opticians are technicians who now are specialized in fitting of spectacles and contact lenses. And then there's another term which most people confuse. We have healthcare workers who are called optometrists. Now, optometrists are now healthcare workers who mainly provide primary vision care services, and they can prescribe spectacles and contact lenses. But they're also not medical doctors, but they are part of the healthcare workforce that provides care in the eye issues.
Hapo sawa. Mfanya vizuri ukasema you are a doctor first, because niko na swali ya madaktari. When we come to hospital pale kwa casualty, the first thing you do is you start checking our eyes with a torch TV. Why do you do that?
First, we have to do, you see, as a doctor, when you come to me as a doctor because of whatever issue you have, I have to do what we call a general examination. And that is just part of the general examination that we do as eye doctors. And then one of the baseline tests that we have to do, it's just like when you go to a physician, I'm a daktari, a general practitioner, they first take your blood pressure, they take your temperature. Now for us, our basic test is vision, how far you can see, how well you can see. Yes, that is our baseline test. Yes, that we do.
Kabisa.
Before we now get into other tests.
Sawa sawa.
Yes.
Sasa today we want to talk about eye care. Sindio?
Yes.
Because I think hakuna part sensitive kwa mwili kama macho. It has to be the most sensitive part. And it requires a lot of health. I think when you blink, that is a reflex action, yes?
It is a reflex.
It does not have to go to the brain first.
It does.
It does.
Everything that the eye does is coordinated by the brain.
My teacher told me reflex actions sometimes do not require the brain.
No, but the brain finally, let's say if you're brain dead, you're not able to spontaneously blink.
Okay.
Yes. Yes.
Someone told me blinking is the plural of winking. So, you know, there are a lot of misconceptions about eyes and everything. So when we talk about eye care, because we will come back to that and discuss the misconceptions, let's talk about what you should do in regards to protecting your eye, because there are diseases that affect the eye, the infections. So what are the things that bring these infections? So maybe someone was born well and now they are going partially blind. What could be causing all this?
So the eye conditions are actually very wide. Some are infections, some are not necessarily infections. We have eye conditions that people are actually born with. Children are born with. We call them congenital eye conditions. So those ones are not necessarily infections. You might find that some children who are born premature are born with parts of the eye which are not fully developed. So that can actually affect their eyesight. And then also there are those eye conditions that happen when the baby is still in the mother's womb. So you find that these children, when they are born, they also present maybe with poor vision. This could be attributed to vitu kama, let's say, the mother had infections during pregnancy. And then there are also those eye conditions that come due to injuries during childhood. So those also could also interfere with how a child sees. Now for adults, there are also very many things in the eye or conditions that would interfere with how someone sees. For instance, injuries, of course, that cuts across board from children to adults. And then now we have the infections that you're talking about. There are different kinds of infections, which some we just pick from the environment. Some maybe you come in contact with someone with an eye infection, they rub their eye, they touch on a surface, and then you also come and touch on the same surface, you rub your eye, you get that infection. And then you also have other eye conditions that are not necessarily infections or due to injuries. They are due to the things happening in our body, due to systemic issues, like diabetes. Diabetes can affect your eye. It's one of the organs that a patient with poorly controlled diabetes can have. High blood pressure, hypertension, can also affect your eyes. When it's not well controlled, that can affect your eyes. Some kidney conditions can actually affect your eye as well. And then also there are some conditions like cancers. We also have cancers that are specific to the eye. And then you can also have cancers in other places which can spread to the eye. Yes, so the eye conditions are actually very wide. There are very many.
Okay.
Yes.
We will get to them step by step. But I also want to engage people at home. Wewe mna wale mnashindanga mkisema nitumie za macho. Wale mnaitishaga za macho. Sasa pia mimi nataka mnitumie maswali za macho leo. Sawa? Amnitumie za macho, mtumie maswali za macho. Ni swali gani uko nayo? Ama ni kitu gani unasikiaga huko mtaani? Watu wanabilivigi, unaweza yuko macho ya kondoo. Vitu kama hizo leo tujibiwe zote, si ndio? Mjiachilie kwenye #daybreak na SMS number 22422. Mjipeleke na skip mniambie swali gani unataka ijibiwe na daktari, because well, wapi wengine utajibiwa free. It's only here. Back to you, Doc.
Yes.
You see, there's conditions you've mentioned, okay, that someone wasn't born, say, blind, and these things came. Are these conditions reversible?
Now, some are reversible, some are not reversible. This depends on at what point the patient presents. Most of the conditions, when the patient presents early for checkup or for eye evaluation, are actually treatable and they can be reversed. But now, when patients present late with some conditions, especially the ones that involve, let's say, the nerve, there's the nerve that connects the eye to the brain. So when a patient presents with a nerve that is already affected, it has undergone what you call atrophy. Atrophy is basically, I would say, hiyo mshipa imekufa, you know, so that becomes really hard to reverse. So if a patient presents early, most of the conditions are treatable and reversible. Yes.
Okay.
Yeah.
Let me just ask, like a layman, mtu anaweza kuwa kwa macho ya kondoo?
That is
because
actually...
you see, last 2 weeks ago, I had an infection in this eye. It had a swelling, and people, my friends were telling me, utako macho ya kondoo, utako macho ya kondoo. But Mungu akasaidia ikapona. Well, I also went to hospital. Is it possible to have an eye transplant?
That is actually... for eye transplant, I can't say you can transplant the whole eye. Let's start from your first question, your macho ya kondoo. So, mtu haezi yekwa macho ya kondoo. For you to get a transplant or a graft, it means you have to be compatible with wherever the donor of that graft. Okay. So, kondoo na binadamu hako compatible. Okay. So, you cannot transplant macho ya kondoo kwa mtu. But there are parts of the eye which can be transplanted, especially from another human being, okay? So like the front part of the eye, the yambele kabisa, it's called the cornea. So you can actually get a cornea from someone else and transplant it to someone else, but not the whole eye, yes.
All right.
Yeah.
Abosa, what do you think is a major challenge to people seeking eye care, like say, come to hospital maybe early in time and say, you know, I think my eye is an issue? Why do you think people take so long before they come to hospital?
I think generally it's because most eye conditions are silent. Maybe infections, people will see you with a red eye and then you'll have some pain, but most eye conditions are actually silent. And especially when it starts with that one eye, most patients do not realize there's something happening. So till the vision has really gone down or the other eye is affected, that's when they start realizing, hey, I cannot see well. So by the time they are coming, you find that it's a bit too late. And then also it's just because of maybe general lack of knowledge that something can be done. And then they don't really know. There are doctors who are specialized in eye care. So what people tend to do, they buy over-the-counter medication. So mtu anaenda kwa chemist, macho yangu iko red, nini. So you're given eye drops, you keep putting you get slight relief, you forget about it. So by the time you're presenting, it's late. And then also the other thing is generally there are not so many eye doctors in the country. So also maybe getting to that specialized eye care is a challenge in most regions of the country.
Right.
Yes, yeah.
Let me ask, why do eyes turn red? Say maybe when you're drunk, why do eyes turn red?
So there are actually very many causes why eyes would turn red.
Yes.
So of course, ukikunywa, the eyes can turn red, your vessels will dilate, zitakuwa red, there'll be congestion of blood in the eyes. But there are actually more than 20 causes of why the eye would turn red.
You said blood in the eyes?
Yes. Blood, just like every other organ of your body, has blood vessels.
Okay.
So hata huko ndani kuna mishipa ya damu. Yes.
That's why your eye will turn red?
Yes, so ukikunywa sana pia your vessels could be dilated, alafu macho ikuwe red. But apart from that, there are also many other causes of why an eye would turn red. Infections would cause the eyes to turn red. If you don't get adequate sleep, your eyes could also turn red. There are actually so many causes of why an eye would turn red. Allergy of the eyes can make your eyes turn red. There are very many causes, and that is why we actually advocate that when you have a red eye, do not go buy medicine over the counter. Have your eyes checked, if possible, by an eye specialist, because there are so many causes. At times you go buy over-the-counter medication just to clear the redness, but you see you're not treating the cause of the redness. For instance, maybe you have fever, uko na mwili inakuwa na joto, and then you take paracetamol. You're actually treating the temperature, the fever, but you're not treating the cause. For instance, maybe the cause of the fever is maybe malaria. So unless you get the malaria treatment, just taking Panadol to cool the fever without checking the cause of the fever does not really cure the disease. So redness of the eye is actually just a sign that there's something happening. So that's why you need your eyes checked. Some eye cancers even present with redness, especially in children. Someone just presents with a red eye. So you keep putting eye drops and all that. By the time you're getting specialized care, it's already too late. Maybe the cancer has even spread from the eye to the brain. So that is why it's very important for any red eye, it's good to have your eyes checked.
What about brown eyes?
Brown eyes also come due to a number of factors, mainly due to allergies. Yes, that can cause that. Yeah.
Is there a cause for alarm?
Yes. Because just, you see, your eyes generally, as you grow older, they'll not be sparkling white. But also if there's that, the brownish pigmentation, when it's too much, especially in children, it's good to be checked, because most of the time you find it's a sign of allergy, which when it's not treated in good time, also has its own complications. Yes.
All right.
Yeah.
Wewe mko na maswali, watu wamejiachilia bado hawajajiachilia, mimi naanza kuuliza zangu. I can start asking my questions, okay, because kuna common myths tunakuaga nazo sisi kama we will get to eye care. I just want first of all to debunk some things. Like for example, when your eyes start twitching and people say you'll get money, you'll have visitors. You'll have visitors. Have you ever encountered such incidents where someone might have a problem and they think they're just superstitious? Yes.
We have such superstitions, just like in many other aspects of healthcare. So that happens, like the eye twitching, people say utapata pesa and all that. At times it's not something to really worry of, but when it's too much, it could be even a sign of a nerve issue. Yes. So that happens, but when it's not too frequent, it's not associated with any other eye problems, usually nothing to worry of. The other myth that you talked about is the transplant. Kupata macho ya kondoo transplanted into someone's eye. Those are also myths. The other myth, which is common nowadays, is about watching TV. Kwamba watching TV makes your eye or will make you go blind. Watching TV in itself is not a problem. But the problem is when you're always watching TV, especially for children, where the eyes are still developing, they're growing, is watching TV or whatever screen, simu, at a very close range. So there are studies which have shown that children who are just exposed to near work, you're always on the phone, you're watching TV very closely, tend to be short-sighted in the long run because they're not exposed to, outdoor activities. Their eyes don't, they're not exposed to doing a lot of far work and all that. So a lot of near work tends to predispose children to being short-sighted.
Kabisa.
Yes.
What causes short-sightedness and long-sightedness?
So short-sightedness, I've just told you one of the risk factors, but also it's more of how your eye, the size of your eye, how long your eye is. So people who are short-sighted, the eyeball, the ball in the eye tends to be long. So let's say if I'm looking at an object that is at a distance and my eye is long, if you can remember kidogo physics, so there's usually the part of the eye huko nyuma yenye the light rays from the object have to be relayed for the nerve ile iko kwa macho to take those signals to the brain for it to interpret this is an object. So if your eyeball is a bit long, unapata because of the distance, those rays are not relayed on that part of the eye. Ile ya huko nyuma inaitwa the retina.
Okay.
So the light rays are relayed hapo katikati. So short-sightedness just means you can only see well things which are near.
Right.
So for you to see well that object, lazima usonge karibu. Yes. So now long-sightedness, usually it's because your eyeball is smaller. Okay. So instead of now lights from an object being relayed on the retina, it's relayed behind the retina. So for you to see well, you have to move a bit fast. So long-sightedness just means you can see better things which are far. So this is a group of conditions tunaita refractive errors. Okay. We also have people who have one kind of refractive error that is a problem with reading small print. I'm sure if you ever go to functions or something, you see the older people who have to move their books, a bit far.
Yes.
Or if you grew up with parents or aunties who used to do a lot of sewing, that's the time they'd call you, kuja uingize uzi kwa shindano. Yes. It's also one of the conditions that happens, but it is age-related. So especially from 40 and above, that tends to happen. So these eye conditions usually are managed by spectacles. So you correct the short-sightedness or the long-sightedness or this difficulty of reading books with small print with spectacles. Now the short-sightedness and the long-sightedness can also be corrected by contact lenses. These ones you wear inside the eye. And then also nowadays, with medicine is very dynamic, so we also have laser eye surgery. For people who don't like spectacles. So you can do laser eye surgery and throw away your spectacles and you'll be able to see well.
What does that entail?
So it's where you use laser to just, restructure the eye so that you're able to focus on an object that is far or an object that is near. So there are tests, preliminary tests, which are done to see how now the front part of your eye, the cornea is, how thick it is, and then if you qualify for this laser, there are different types of laser, so that is determined after doing these tests. So, and then that is done.
All right.
Yes, and it's actually available in a country. I know many people don't know, but it's
available here.
Yes.
Ala tuko mbele.
Tuko mbele kabisa.
Ama tumeona mbele.
Yes.
There are people say when you're in a room that is not very well lit, and then you step out, you feel some type of pain cutting up at the top of your eye, and for some time you have to adjust. Then now you can see outside. What could be the cause of that?
Actually, that is a normal physiological process.
Okay.
So if you move from a very well-lit room to a fairly dark room, there is what we call light to dark adaptation. It is a normal physiological process. And vice versa. If you move from a dark room to a light room, there's also that, the few seconds that your eyes take to adapt. Those are normal physiological process. And it's just basically because in your eye, the eye has so many structures. There are also those cells, which we call photoreceptors. These are cells which are usually sensitive to light. Now we have those ones which are, work when you're in light, in bright light, and there are those ones which work when you're in dark. So it's just that adaptation as one type of cell is adjusting to pick up now the change in the illumination. So that's why you feel that.
Does it have to be painful?
It should not be painful. And when it is painful, usually there could be an underlying eye condition, and that is why you need checkup. because there are very many causes that would cause eye pain, things that would cause eye pain.
Kuna watu pia wakipigwa picha like kama mmeweka camera flash ina affect macho ya mtu sana, like maybe you will not see for some time, like say a minute or so, like you can't see clearly because of that flash. Is that also normal? Because it doesn't affect everyone. So what could be the cause of that?
Unless someone has other symptoms which would maybe we could attribute it to an eye condition. There's just people who are really, really sensitive to light. People with allergies, you know, people with other eye conditions. There are people who are really, really sensitive to very bright light. But also there is, you know, when the brightness is too much, anyone and everyone will be affected.
So is that a reason to go to hospital also? Because
yes, for anything that is not normal. For any, I usually say, if you're not so sure,
yes,
go for checkup.
It's not something that would treat itself, because that is what we are accustomed to.
No, if you're in doubt, just go for checkup. You're better off going for checkup, and then you're checked and you're told everything is okay, than assuming and then later on you come and it's a bit too late to do anything.
Okay.
Yes.
So we need to take a few questions from people at home. Tuone kama utatusaidia one tu, si ndio? Sio kama utatusaidia, utatusaidia.
Of course, that's how the idea is.
Si ndio? Haya, wa kwanza hajaacha jina, ni SMS. Ameuliza, if you've got one eye injured but by the time it heals, can it affect the other eye, please?
Yes. If you have injury to one eye, it can affect the other eye. Yes.
How so?
So now, how the eyes are anatomically. So we have two eyes. These eyes actually have nerve connections somewhere in the brain. So at some point in the brain, there are nerves that come from the right eye that cross over to join the nerves from the left eye. So there are also nerves from the left eye that cross over in the brain to join the right eye. So now, when one eye is injured, it is a possibility that because of that nerve connection, so that when one eye has a problem, the other one will sympathize. It's actually called sympathetic ophthalmitis. Don't mind about the name, but it's just about one eye sympathizing with the other.
Okay.
And actually, we usually tell people, if you even got injured 10 years ago, and the other eye has issues some years later, go for checkup. Because this condition can actually happen a few days from the time of injury up to almost 60 years after the injury. Yes.
Allah?
Yes.
Okay.
So that can happen. When one eye is injured, the other one can sympathize and have symptoms.
Okay.
Yeah, of maybe infection or whatever. But it's usually because of the connection, the nerve connections between the two eyes.
All right.
Yes.
So let's talk about then taking care of the eye.
Yes.
What are the do's?
So the eye, as we said and we agreed, is a very sensitive organ. So one of the major things that the eye, for eye care, is having regular eye checkup. And especially for anyone above 35 years. Just the same way we recommend general checkup annually, one of the things you need to do is have, if possible, an annual or after every 2 years, eye checkup. Because most eye conditions, as we said, are silent. And especially when it affects one eye. The other eye, you might not realize because the other eye is trying to compensate. So by the time you're presenting, the vision has really gone down. Now, the other thing, the eye is part of your body. Nutrition is very important when it comes to the eye. I'm sure when growing up, we'll go and be kula carrots. There's a reason why that is important. So fresh leafy vegetables, fruits, carrots are very important for your eyes, and especially for children as their eyes develop. That is very important. The other thing that is important, exercise. You might think exercise is just for obesity and all that, but also these things, the eye, I usually say the eye is like a mirror to your body. So anything affecting your body, like diabetes, hypertension, is going to affect your eyes. So exercise is important. Physical exercise. So physical exercise will help you to be, in good health, ensure your BMI is within normal. So it helps you prevent things like the lifestyle diseases like diabetes, hypertension, which eventually can affect the eyes when they're not well controlled. So that is very important. The other thing that is important for your eye is I usually tell my patients, nowadays we can't do away with technology. It's here with us. We are on the phones, we are on the screens. But it's very important to consciously take breaks, frequent breaks from the screen. I usually use the 20-20 rule. So for every 20 minutes, take 20 seconds to look 20 feet away. Okay?
All right.
So when I say a break from the screen, let's say you're using a computer. The break does not mean now move from your computer to your phone. You're just moving from one screen to the other. Yes. So take a break off the screen as frequent as possible, because one of the eye conditions you're seeing lately is what you call dry eyes. Dry eyes is more because of, when you're on the screen for too long, your blinking rate goes down, so your tears tend to evaporate more. Lubrication of your eyes is interfered with. So at the end of the day, you find that someone has been on the screen for too long. Now they're presenting with red eyes, irritation, feeling like there's sand in the eyes. So it's just because of, a lot of screen work without taking breaks from the screen. And even the glare from the screen can also affect your eyes. So that's why it's important to consciously take frequent breaks when you have to work on the screen for too long. Yes. All right.
Before you come to the don'ts now, let's take some feedback from home. Then we continue, sindio?
Yes.
Okay. Mwingine amesema, hello, I have a blood vision on one eye since 2009. How do I treat it?
So blurring of vision is just a sign or a symptom to show that there's an underlying problem. There are many eye conditions that can give you blurring of vision. Things like infections can cause that. And there are different infections. We have infections caused by bacteria, viruses, fungi, and they're all treated differently. There are other things which can even make your vision blurry. What I was telling you, being short-sighted or being long-sighted. So there are also conditions which can affect the inner parts of the eye. Like there's usually a lens in the eye, which when it's supposed to be clear, like a glass. So if it's not clear, it starts becoming opaque. That we call cataract. That can cause your vision to go down. Further deep into the eye, we have the nerve that connects the eye to the brain. Any nerve issues, infection, inflammation can cause the eye not to see well. Some even conditions in the brain, including things like tumors of the brain, can actually affect your vision. So it's really, you can't tell a patient because you have blurry vision, get spectacles. This is someone who I'd recommend go to an ophthalmologist, get your eyes evaluated so that the cause of that blurring of vision is determined and then appropriate treatment is done.
True, considering they've said it's one eye.
Yes.
All right. Yeah. Next one. I have my daughter, 5 years old, and every time it keeps producing tears and always watering. Ask the doctor the likely cause and possible remedy.
Okay, so that is a tearing eye in a young child. So one thing that anatomically, the eye, there is a way the eyes produce tears, and those tears don't stay there. Those tears are continuously produced and drained through a duct which connects the eye and the nose, down, and you swallow it. So there are children who can have obstruction, like when that duct is blocked. It can be completely blocked or partially blocked. So depending on how the blockage is, that eye will tend to produce tears. So it's a possibility that is the cause, especially if it's one eye. But also other conditions can cause tearing, like even allergy for the eyes. But that tends to be both eyes. But if it's one eye, that is the likely cause of that. That is a patient who can be helped with evaluation. There are different procedures which we do to try and open that duct. But we have to first examine the patient, ascertain if that is the cause of the tearing, and then now decide on the best way forward.
Okay.
Yeah.
Is it the same also for, say, a grown-up?
Yes. Because you can even have that duct obstruction in grown-ups. Oh. There are children who actually even are born with that. A child is born, one eye is just tearing. Yes, so it can happen in, like, before a child is born. It can happen in, the early years of life. It can also happen in adults.
All right.
Yes.
There are people that have headaches that affect their eyesight. Like it's blur, you cannot see. What causes that? So
headaches is a sign of other things. It can be the eye, it can be something beyond the eye. But if it's headache that is associated with not seeing well, the things I talked about, being short-sighted, being long-sighted, that can cause headache because your eyes are straining. And the eyes, as I said, the eyes are connected to your brain. So because the eyes are straining, the brain will complain.
Okay.
Yes. Other issues can also cause you to have blurring vision, like diabetes. When your sugars are high. We've had patients who just come, they didn't know they have diabetes. They think it's an eye issue. They come to the doctor, I can't see well. You send them to do a blood sugar test, you find their sugars are very high, in their 20s, 30s. So that can also cause blurring of vision. But headaches is not entirely an eye issue. There are other issues which can cause you to have blurring of vision.
Okay.
That comes with a headache, including some brain issues, including brain tumors and such things.
All right.
Yes.
Let's take one more from home. It says, mimi niko na my sister alikuwa na shida ya macho kwa kuanza kutoa uzaa usiku akilala na hakuzaliwa hivyo, ilimpata tu akiwa na 16 years. Kwani shida ilikuwa nini na mpaka saa hii haioni? What causes all that?
So what called the uzaa is usually discharge. Usually that is a sign of eye infection. It's usually a sign of eye infection and that can be treated. So those are patients you tell to come to the doctor early because these are some of the eye conditions which can be treated. So the problem with infection, if it's not treated and not treated in time, it can complicate. It can even cause the front of the eye, hiyo ya mbele kabisa, inaitwa the cornea. So some of these infections, when they are not treated, they can interfere with the transparency of the cornea. So you get a scar because of an infection that wasn't treated. So once that scar is there, definitely the patient will not be able to see well.
True.
Yes.
So as we wind up now, let's talk about the don'ts.
Yes.
What are the things that you're not supposed to do while treating your eye or just generally to your eye? Because maybe you'd get someone trying to wash their eyes with salty water because maybe there's an irritation. What are the don'ts?
So some of the don'ts that I actually say is self-medication. You know, going over the counter, you woken up, macho iko red kidogo, it has discharge or it has pain. Going over the counter, you buy medicine over the counter, you're putting, what are you treating? You really don't know. So those are some of the don'ts that I'd say try as much as possible to seek specialized eye care, or even if it means going to the general practitioner so that they see. If it's something beyond them, they usually will refer to an eye specialist. So avoid self-medication. As I talked about the children, encourage children to do a lot of outdoor activities. The thing of children being on the phones throughout, very closely watching TV, just a lot of near work, predisposes them to some of these conditions like being short-sighted. Yes, those are some of the don'ts. Yes, yeah. The other thing which is very common is, illicit brew. Going to some places, you really don't know what concoction you're taking. We've seen patients go blind on some of these illicit brews. So as much as possible, Kenya, let's avoid that.
Okay.
Yes.
Kabisa.
Yeah.
Ni kwanta ngojeni Ibra one more minute lazima niulize ni kitu iko mtaani. Tunaambiwaga that say if people went and took illicit brew and they were brought to hospital, the first thing you give them is alcohol. Is this true?
Okay, yes, it's some kind of alcohol we give, but now it's a special alcohol with a specific concentration that we give to counter the effects of the illicit brew that we give. Yes.
It's not the normal beer you'd go by.
You can actually use some of the whiskeys, but it depends on the concentration and the type. So as the doctor, you determine which one to reverse the effect of the other one. I know that those patients will be very happy. I got nilienda nikakunywa illicit brew, nikakuja hospitali nikaongezewa ingine. We use that to treat. Not that we're encouraging that, Yes. So the other thing that the don'ts that I was saying, smoking. Yes. Smoking is actually one of the things that predisposes you to some eye conditions, like eye cancers. Yes. So it interferes on how your cells in the eye regenerate and all that. That also is one of the things that we really discourage because of the risks that come with it. Now, one of the things you also encourage is, of course, the eye checkup, general hygiene for your face to avoid infections. When you're outdoors and you're doing, let's say you're a welder and all that, we encourage people to use protective eyewear to, you know, avoid unnecessary injuries. And even for the general population, if you're in a place where the sun is too hot, wear your sunglasses, because the UV light from the sun also can predispose you to many other things, including some cancers of the eye. Yes.
All right.
Yeah.
Okay, as we wind up, where did your interest with eyes come from? And how can we get you in your social media handles?
Okay, so when I graduated from my undergraduate, I actually wanted to be a neurosurgeon. So what really transforms you into a doctor is during internship. That's when you get hands-on and exposure to all the other specialties of the eye. During my internship, I realized there's very few eye doctors in the country. It's actually a big gap. We are about maybe 120 something out of all this population for Kenya. So I thought it's one area that really needs, you know, more doctors to come on board. Okay. That's how my interest came in.
Yes. So where can we get you?
So I'm mainly at Mbagathi Hospital, but also if you need to see me privately, you can find me at Upper Hill Medical Center, 4th floor, and Nairobi Hospital, Nairobi Eye Associates, also on Anderson Building, 4th floor.
Social media handles?
Social media.
Say someone with questions, maybe they want to follow up from whatever you've said. Can they get on Facebook, Instagram?
Yes, I'm on Facebook as Brenda Walaba. I'm also on Instagram as Brenda Walaba. Yes. LinkedIn also. I'm there as Dr. Brenda Walaba.
Kabisa.
Yes.
Thank you so much.
Thank you.
Nimeshukuru sana. At least I've learned a thing or two.
Yes.
My friends were telling me nitaweka macho ya kondoo. Now they know.
Tell them that's
it's not possible.
Yes, and I hope also our viewers,
yes,
they've learned one or two things.
True.
Feel free to reach out whenever you have queries about your eyes.
Asante.
Yes.
Wadau, mmesikia leo nimewadunga za macho. Leo nimewadunga mapoint, ndio za macho. Muo life. Asanteni sana for your time. Hey, kesho mimi nimeihold it down for Willis Raburu. Nifuate Facebook Shatter Boy, Instagram Shatter_boy, Twitter Shatter Tikitaka, YouTube Critical Shatter Boy. Till next time. Muo life kabisa.